Are you ready?
As ready as I'll ever be. Are you ready?
As ready as I'm ever going to be because we are on the air.
Hot diggity dog. Welcome to Sazilla. Today is Thursday. Yes, we missed last week. Life happens. It was just one of those things. It was so funny. I'm Susie. That's Matt. This is Wenatchee Insurance.
Yes.
And we normally do this every Thursday, but we did have a gap in a week just because, like I said, life happens. So we're back today.
Yeah, and we decided we're going to go hard into healthcare.
We're talking the big guns today because we know there's some significant changes coming in 2026.
Well, yeah, we prepped one group really good, and they went off and they said, "Oh yeah, we created it all ourselves."
Yeah, that kind of made that ticked us off.
So yeah, we decided it's like, nah, we're not going to support you that way anymore, and we're going to go do. But we're getting continuous requests. About material, particularly Medicaid.
Yeah, Medicaid's going to make okay. So the big beautiful bill, the Trump tax bill,
the budget that the Republicans passed,
okay, is going to slash Medicaid contributions by about $8.5 billion.
It's the largest cut in history.
Yeah.
There's no way around that. It's the largest cut in history.
Yep.
There was some assigned excuses on it's not going to hurt you because it's going to impact only undocumented, and it's going to steal the care away from transgender, and we're going to block abortion.
Okay. First off, people who are undocumented don't get Medicaid. They never have.
Okay.
Unless it is an emergency situation.
This is one of my biggest pet peeves.
Uh-huh.
Okay. There are 6 states that will use state dollars to take care of undocumented. Washington State is one of those ones.
Yeah, I mean, that's the emergency fund.
Some of the emergency fund, it's the kids.
Well, yeah.
There are like I said,
I'm not counting the kids.
I know. Everyone does it, and it's really disingenuous.
Okay.
And so, yes, there are state dollars.
Mm-hmm.
Now, one of the first things that was clawed back was, and they got it for the first again, was the DACA recipients.
Oh yeah.
And poof, that's not being talked about.
Right.
And I've been continuously talking about it because it is freaking important.
Mm-hmm.
Is DACA recipients? There was probably about 800,000 left.
Yeah.
Because it's a really specific program. It does not grant It does not grant citizenship.
It doesn't really even grant a path to citizenship.
Yes, it was a stopgap measure to, say, hey, you're legit. You're taking care of business. Woohoo! Let's figure you out. Let's set up this program.
Right, and it was supposed to create a beginning point to build that path to citizenship. These are people who, as small children or infants, were brought to the United States by their parents. So they weren't born in the United States, so they're not, residents because they're not citizens because they weren't born on American soil. But they've lived here since they were small children, never lived in their quote home country. And some of them don't even speak the language. They don't know anybody over there, and they're all in danger of being.
The United States is their home. They're losing their federal tax credits August 25th.
Right. They're all in danger of being deported.
Correct.
That's why if they break the law, they could get deported to a country they've never been to.
Oh yeah. So yes, they're losing coverage. However, this is important. However, yes, despite they'll lose federal tax credits on the 25th, 26th, when Washington State CARES Act program kicks in, they will be eligible for state tax credits.
Right, that $250
up to $250 is the
$250 the current line.
Current number they're working on.
Right.
And that is because Washington State went through and got an exemption.
They got a waiver.
They got a waiver to set up health care to cover immigrants. They went through the formal process. It was approved by the federal government. Nothing crazy about it. It's what the innovation waivers are designed to do because of the Affordable Care Act.
Exactly. And it was a great use of the innovation waiver.
Correct, because the undocumented is the largest uninsured population in Washington State.
Yep.
This allows the folks that, if they're not offered one through a job, if they're self-employed, if they're going to school, to purchase a health plan.
Yep. And so they can stay healthy and stay a contributing member of society. Because these people pay their taxes.
Yeah.
They contribute. They're members of your community.
Yes.
They're your neighbors. They're your friends. They're your local business owners. They're the guy who cuts your hair.
And it's important to understand that, hey, if we strip their ability to get health care, when they roll into a medical center getting medical care, that medical center has got to eat the cost if they've got no means of paying for it.
Right. And it's going to create, that wasn't what's supposed to happen. It's going to eat into the charity care funds. It's going to send people to collections. It's going to drive people into bankruptcy.
Well, the CEO of, I believe it was Three Rivers up in Okanagan County, was the first person to mention they don't know how. Give me that. Just give it.
What? I could just leave me alone.
This was the first one that mentioned that they do not know on how hard the compassionate care program is going to spike.
No, it's going to go hard, and it's going to be used way more than it was ever designed for.
Well, also, one of the things that happened in the last 5 years or so was Washington State said, hey, hospitals, you've got to have this pool. They've got to have this financial pool. If you say you're a nonprofit, you've got to be using it for when someone rolls in they can't afford it. We got to have standards for compassionate care usage.
Exactly. Now,
so that increased the amount of people that were using compassionate care, and now we're going to increase that population dramatically.
Yeah, which is going to drain those pools. It's going to damage the pools.
Now, folks are starting to talk about, well, how does that impact me? Okay, I had to actually look it up. There are 28 health clinics.
Okay.
In Washington State.
Okay.
Mostly in rural parts.
Right.
Like Eastern Washington.
Right, because we are a smaller population and a bigger geographical footprint. Not a bunch of people in a whole bunch of space. And so a clinic is an appropriate move because you don't want to put a big hospital in a county that has 5,000 people.
Oh yeah, these are, hey, I can patch you up, get you on the chopper, head you over to Harborview.
Right, exactly. This is day-to-day care stuff.
That's right now.
Oh yeah.
And I'm going to say that right now.
Yeah.
And the reason I say that right now is because they receive a large portion of their funds from both the immigrant population that are paying on the sliding scale.
Yep.
Plus the folks that are using Medicaid.
Yep. And the folks that are using Medicaid are in danger of losing that coverage.
So you've got that immediate pullback. And this is before you get to the 14 hospitals.
Oh, yeah.
14 rural hospitals that derive the majority of their income from Medicaid.
Yeah.
And
imagine if you were a state that was a poor state where almost every facility, their majority of their income comes from Medicaid. We're not a super poor state. We've got poor counties, but we're not like Alabama poor.
Okay, now the 14 Samaritan Hospital in Moses Lake,
Mhm.
Toppenish Community Hospital, Summit Pacific Medical in Elma, Odessa Memorial Hospital, Cooley Medical City in
Ooh.
Grand Coulee,
Hate to lose that one.
Prosser Medical Memorial Health, Klickitat Valley Health,
Super important.
Othello Community Hospital, Three Rivers Hospital in Brewster,
The only place up there.
Forks Community Hospital, Mid-Valley Hospital in Omak, Asteria Sunnyside Hospital, Mason General Hospital in Shelton, and Providence St. Joseph's Hospital in Chewelah.
Those are all pretty. They're farmer communities. You know, they're small. They're small communities, and these hospitals are the only care for a lot of them.
Yeah, and contrary to popular belief, being a farmer is a dangerous occupation where a lot of people lose things.
Yeah, and not their car keys.
Yeah, not their car keys.
Yeah, they lose limbs and stuff.
So you've got the clinics that are going to be peeling back, and it's going to be pushing over to the hospitals.
Right.
And the hospitals are going to be overwhelmed. Right.
Because if you walk into an emergency room, the hospital is required to care for you.
They're required to stabilize you.
Yeah, and they can punch you out to somebody else.
Which doesn't mean you get care for free.
Oh, no. There's no such thing as free when it comes to health insurance. Somebody's paying for it somewhere.
So you've got this snowball effect.
Mm-hmm.
And we saw it in about 2019 with the carriers when they retreated counties.
Mm-hmm.
So odds are we're going to see the medical centers and the hospitals retreat into the urban populations.
Yeah, they absolutely will. They're going to constrict. They're going to constrict to the centers, and they're going to hope that people don't die in the 100 miles it takes for them to get here.
Yes.
It's going to be a boon for the ambulance companies.
Yes, the air ambulance companies are going to make bank.
Yeah.
And there'll be fewer people to pay for it, which leads to the spike in the uninsured rate.
Mm-hmm.
Because that's one of the things. So we got the providers that are starting to go, oh my gosh, the horrors of horrors is going to happen.
Mm-hmm.
And we've already seen in our state,
mm-hmm.
We're not the first state to do this.
Mm-mm.
Have an administrator look at their 5-year forecast
and freak out.
Well, it wasn't freak out. It's like, okay, how do we keep the large system intact?
Yeah, so we can, so they constrict so they don't collapse completely.
So yeah,
but Providence is working on that, aren't they?
Providence. The following programs will close after Friday, October 3rd. Chewelah, Medicare in St. Joseph's Hospital, Orthopedic Physical Therapy Clinic in St. Joseph Hospital.
Yeah, they're starting to take out the small ancillary stuff, the physical therapy. You'll start seeing the other things like sleep studies and sleep clinics, and the smaller, less used benefits or facilities will start to shrink it.
Less billable,
that too.
The ones with the least amount of profit margins.
Yeah, and physical therapy is notorious for that.
So outpatient, well, it's labor intensive.
Well, yeah.
So
and it's like, well, you could also send someone home with a sheet saying, "Go do this."
Yeah. So outpatient orthopedic physical therapy clinic in St. Luke's Rehabilitation Medical Center.
We're also going to see we will see rehabilitation centers shut down too.
Yep. Spokane Valley outpatient orthopedic physical therapy in Providence Medical Park.
Yep.
So that and it's going to lay off at 50 plus employees.
Yeah. So they're starting with things like physical therapy, and then it's going to go to the next things like sleep study and cardiotherapy and other things until it gets to the point where all they have left is life and death care.
For as long as they can maintain.
For as long as they can maintain. I hope it doesn't get that far, but it could. Mm-hmm. It absolutely could.
So you've got the clinics pulling back. Now one of the ones that has kind of flown under the radar, and I've heard the most about is the VA.
Oh God.
And it's one that I flagged early on.
Oh yeah.
And do the hey.
What the hey?
All these cuts are going to just triple it. I had people in, I went on an interview and I was like, oh well, I've got the counseling group in here the following week, and it's a talk, and yes, they did the shutdown for the counseling clinic, and this year. The Veterans Health Administration facilities reported 4,434 severe occupational staffing shortage jobs.
Mm-hmm. Yeah, and it's not going to get any better.
Doubled over last year's shortage.
Yeah.
94% of the facilities have severe shortages for medical officer jobs.
A lot of what was going on, at least partly, is the subcontracting that they were doing. They were working with contractors, and they can't have those contracts anymore. So those jobs are gone. So they're not being staffed. So there is a huge hole to fill. And
they never were staffed. What they did was they said, "Oh, hey, let's do contractors because it provides flexibility."
Exactly, but they're not renewing the contracts.
And then Doge came in and was like, "Oh, we're going to slash all the contracts."
Right. So no contracts, no flexibility. Nobody who's already there to begin with that was already just employed by the VA. That was already just an employee of the VA. Big fat holes.
Yeah, so they created. Well, you had the hole in the first place. Then they tore the Band-Aid off of it.
Exactly. And now they're just letting all the bugs in. So how is this preventative? Okay, why they're slashing? One of the things that this is also considering is how is this making America healthy again if they're slashing all the preventative care stuff and they're slashing the overall care? It's not. Exactly.
It's by design. This is by design. When you start to lose medical centers, it lowers property values.
Oh, wow. My brain just went somewhere awful.
This is going to impact the poor people first.
Oh, yeah.
Because we can't travel.
Mm-hmm.
And we know that for about every 800 people that lose health insurance, one dies.
Yeah.
That year.
Yeah.
So we're talking you're going to lower property values, you're going to create deaths in a population, a disproportionate number of people of color and the LGBTQ community use Medicaid.
Yep.
So you're going to see those populations basically be
the effort is to decimate them.
Yeah.
Is this just a land grab?
Possibly.
Is this a Scooby-Doo thing?
It feels like a Scooby-Doo thing.
Oh my
God.
Yeah,
that's kind of what is the mechanics behind. Okay, this is the providers.
Yeah.
Let's talk. We're a little over half into it. Let's get into Medicaid.
Medicaid or Medicare?
Let's start with Medicaid.
Okay.
We're gonna work our way.
We've been on working on Medicaid.
Well, no, we talked about the facilities.
Okay.
Now here's some of the mechanics behind it.
Right.
Because we actually saw the start of this in 23 with the unwinding.
Yes.
Now we were ground floor on the unwinding. And we helped a lot of people because that was the point where people started to turn on income verification.
Right. They were getting a lot more. They'd been really generous during COVID and didn't really do income verifications for people on Medicaid.
Well, it wasn't generous. It was, hey, let's keep people alive and not have to worry about this.
Okay, fair enough. And then but they had to get back to those income verifications. So they did. They did the unwinding, and they said, okay, what's your income? And they started to move forward again.
Because there was a large population that had never done that before.
Right. They had, they've been just kind of, as so many of us do, we just kind of set it and forget it with health insurance. It's like, oh gosh, I've got this great plan. I'm not going to mess with it because they just keep giving it to me. It's like, okay. And that had to be reset to original parameters.
Yeah.
And they did that. And so some people lost the coverage because they didn't meet the financial thresholds. And so we moved them into a qualified health plan.
And it really, this is one of the things about Medicaid that folks don't talk about. I'm going to talk about it because We don't get paid a dime for these.
No, we really don't.
And it's very important to note that there are some people on Medicaid that, getting up is a good thing for them.
Yeah.
Out of bed.
Yeah.
Let alone trying to process complicated paperwork.
Yes.
Or, understand the insurance jargon or what document I need here.
Mm-hmm.
And so sometimes we get people's like, well, how does this work? I've had people roll in here and we discover that lo and behold, they got put on Medicare.
Mm-hmm. And didn't even
months
realize
ago.
Yeah, didn't even realize it.
But they were calling it Medicaid. Or they'll call it state care. You got Apple Health, which is Medicaid. Mm-hmm. So there is a significant population that definitely needs assistance in doing this.
That's why we do this, to help interpret this information.
Unfortunately, that's secondary.
Fair.
Because if we help if we get overwhelmed mm-hmm. by folks that are doing Medicaid, mm-hmm. that we're not getting paid for, ooh. It blocks out the people who actually keep our lights on.
Right. So that's where we run into problems, because as things financially fall apart, the folks who are getting paid to help people with Medicaid yes. will lose their jobs.
Yes.
DSHS departments will close. Navigator teams in hospitals and clinics will be shut down.
Well, we still see a lot of folks that get pushed over to our direction from those organizations.
Yeah.
Because they don't got the staffing.
Yeah, exactly. It's already happening, and it's getting
or the administrators don't want to have them give the level of care that we do.
Yeah.
Like, for example, we will print out forms.
Yeah.
We don't do the assumption that everyone is
tech savvy.
Has a computer
or even
access to a printer.
Yeah, or even a phone that can actually look at stuff.
Yeah.
Yeah.
So yeah, you're going to see the assistance for the Medicaid folks really tighten up.
Yeah, and
because the hospitals who run many of the Navigator programs,
they're going to close.
Well, none of they're going to close, but they don't value the folks that are doing the customer service to get them into healthcare.
No, okay. What's going to happen as those facilities have to shrink back? You saw that. Oh, we're going to lose physical therapy. You know who else we're going to lose? Customer service.
Customer service.
Customer service is going to shrink down. That's always the first place to go when you're dealing with corporations. Mm-hmm. How are we going to do this? Oh, we'll cut staffing. We'll cut payroll. Okay, great. That's fabulous. But then you have crap customer service. And then never mind. That's a whole other conversation. But that is going to happen.
So that's going to happen. So yes, unless there's a radical shift in hospital administration.
Which there won't be.
Their customer service is going to be hammered.
Right. And they're going to come to people like us because we do give a shit. Problem is, I can't do that 8 hours a day and not get paid for it. I still have to keep my lights on,
So, yeah, there's going to be some points where we're like, okay, this is what we need from you.
Mm-hmm. Yeah. And I don't want to have to do that, but it might go there. I've never had to do that.
I already told one of the Navigator groups, point blank, they're going to lose some of the younger navigators because they're going to have to deal with people that are panicked, people that are angry.
Yep.
And they won't have the backing of their managers.
No, because they may not even have managers.
So
they might be the managers and not even really realize it.
Yeah. So yeah, and we're already back in 23 they put the start of let's turn the system on.
Right.
Now this last year we've seen where it's been ratcheted up.
Yeah.
Where we've had people go through and have multiple requests done by the healthcare authority to approve their income levels.
And you saw one that was never so detailed. We had one client who they requested so much detailed information that we had never seen before.
Correct.
And I have no idea.
This is our 13th open enrollment. If you are small business, it's one of those things you might run into some difficulties.
Yeah. And they're ratcheting up the audits to at least twice a year. Mm-hmm. They're going to start in with employment verification because you're supposed to be a working poor.
Okay, so right now we're at the one income verification.
Right. They doubled up this year.
There's still one. We gone through our big one in July.
There was the first one. The first wave was like in April.
Usually it's February.
Yeah, it's that spring one.
February. Then there's usually one in May. Then July.
It's staggered. It's not everybody at that point, but it's staggered.
Yeah, it's usually odd months because we always experience a big one in November.
Yeah, that's gonna be fun.
So, yeah, this is on the ground month. So yeah, it's one of those ones that you prepare your documentation, you have it ready to go, and like Susie said, yeah, we went through a process of getting them approved. It was darn near 3 months.
Yeah.
Of battling the healthcare authority.
Yeah. And I swear they were using this person as a training program for the team.
Well, the one of the things was the person made the mistake of using language that the healthcare authority didn't like.
Oh yeah, that's absolutely right. You really got to know how to talk to these guys.
And because there is such a specific language, if you start going off and I pay myself,
ding 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 ding,
they instantly think it's salary versus a company draw because they don't understand small business.
Oh no, not at all.
They immediately started hammering this person, and it was like, oh my gosh, that's horrible. And they went fully on, and yeah, honestly, I don't think it's accurate, and I think they're going to end up getting money paid back when they file their taxes over it. But yeah, if that sort of scrutiny hits a person that might be in a bind,
they're just going to give up.
They're just going to give up.
And that's actually okay. What I remember for so many years, I was saying, yeah, the insurance companies will just deny you until you give up or die. Guess what? Now the government's doing the same thing.
Now the government's doing the same thing. Now it was at a low point of like 4.8% of uninsured.
That was really good number.
That was a great number.
Yeah. So that meant the vast majority of people in Washington state had health insurance to one degree or another.
Now, having those low numbers like that, and yeah, some of it's Medicaid, means that you've got less compassionate care going out.
Yep. That means those funds are being built.
Now, some of the providers used it for great means and cleared some debt.
Oh yeah. Some
of them did the Band-Aid effect and used like travel nurses.
Yeah. Nothing against the nurses themselves, but they were using travel nurses as contract nurses instead of actually hiring staff.
Or having an environment that staff would want to be hired.
Yeah, I mean that was happening. That's one thing we're hearing is that they don't want to work there because they don't want the travel nurses become travel nurses because they don't want the day-to-day crap. And that means the culture in the hospitals and clinics ain't good.
Yeah.
Yeah.
So yeah, so if there isn't a fix and they haven't paid off that debt, that's what puts them into this financial bind that's coming up.
Yep.
And one of the things they've got to work on is improving that culture and is lowering that employee outlay.
Yeah,
and it's not really an employee outlay; it's a contractor outlay.
It is, and that's got to shift, or they're not going to survive.
So so Medicaid, we're going to see that ratchet up to twice a year.
Yep.
We're going to see it ratchet up to employer verification for 3 months at a time.
Mm-hmm.
So basically, it's going to be half of someone's, waking thing is going to be futzing with healthcare.
Yeah, it's going to be a full-time job.
And when you start to look at the different programs that have implemented those, proof of work eligibilities, it's been the same over and over and over again, where massive amounts of people got lost in the paperwork shuffle. There was a case in Georgia, literally the poster boy. This was a man who got up there, did the videos on how great it was to have Medicaid, how great it was to do your proof of work. And he had his policy canceled 3 times in a year.
Oh, jeez. Because he couldn't provide the documentation they wanted.
Because it couldn't provide the documentation that they wanted in the manner that they wanted, in the amount of time that they wanted.
Yeah. And the time they wanted, the windows are getting smaller.
So, you're going to see this drop off. And that's where you get the 300,000 plus folks that are being dropped off. I think that's a low ball. And the reason why I think that's a low ball, in the 12 years that we've done this, we've had a ton of people that have walked in our office that have either they or their kids have lost their Medicaid coverage, and we had to restart it.
Yep. And that's going to be that's going to happen again, and it's going to be much harder to restart stuff.
And it's going to be much harder to restart. And that was one of the things that they've done that went into effect, was under the Inflation Reduction Act, they allowed folks that were making up to 150% of income
above the federal poverty level.
Above the federal level, be able to start a health plan.
Right. It was a special enrollment for that income bracket. That's going to be gone again.
That's going to be gone. That's going to be gone.
That one.
That's going to be gone on the federal level. Now, it's hard to say because we had one in Washington State.
Yeah.
Because the waiver.
Right.
And no one has said, "Oh, hey, waiver," and that goes away. I think that's still in play.
And that would be cool. Okay, that is that we got to stop because we've hit our time, and that's a good place to stop on, unless you've got something else you must discuss.
Okay, so we've seen the Medicaid, we've seen that, we've seen the hospitals. This is the thing: if you have a paid plan, you're going to see massive increases.
Yep, your rates are going to go up.
Your rates are going to go up. We tell everyone, hey, between November 1st and December 15th,
you got 45 days.
Is your enrollment window for a January 1st start date.
Yep.
If you want help with it, and you probably should, because rates have gone a little bit crazy.
Yep.
The plans are going to be a little bit different. Set your appointments now.
Yep, absolutely. Set your appointment now, and we will get you taken care of.
Medicare runs from October 15th through December 7th.
Right.
We know that the Plan D coverages are going up.
Yep.
They're going from an average of $32 to $36.
Yeah. So that's and the we know that the Part D deductible is going to go up. It's going to go from $590 to $615, and we know the out-of-pocket maximum is going to go to $2,100. We know that the rates are going to go up.
Have they announced the Plan Part B coverage?
No. We do not know what the Part B rates are going to be. There's some projections. The estimates are running at around about $206. So like a 21% increase.
Okay. So yeah, right now we're Part B premium runs $185.
So it's going to jump about $20.
So yeah, it's probably going to jump. And if that's a deal breaker, you want to jump into that open enrollment and look at what
see what your numbers are going to do.
See what your numbers are going to do.
Yeah.
Now, if you've got a corporate Medicare plan. We're talking your PEBs, your Boeing retirement funds, your public assistance. You need to talk to those people.
We cannot help you with those. And we cannot take those appointments because we've got people we can help. And I want to have the appointments available for them.
Yeah, and if you're like, hey, they're not taking care of me, you need to talk to your representatives.
Yeah, exactly.
Because in our state, the healthcare authority is the largest purchaser of health insurance.
Yep.
They can say, oh my gosh, we go over here. So we got Medicare, we got the individual plans, we got the VA. The last little bit, I think that is it.
Well, we can address more of this next week.
No. I wanted to be out there, let people know, hey, do your homework.
Yeah, do your homework. Call your legislators and yell at them.
On all levels. Mm-hmm. Oh, whole health.
Whole health?
Whole Washington. They're trying to smooth things out. It's the Washington single payer.
Oh yeah.
There's it's universal care, single payer. Read the legislation. It's not an instant change.
Mm-mm.
It requires federal signatures to implement it.
Yep.
And the Medicare plan for them is to take it and put it into a Medicare Advantage plan.
Right. This is not a everybody gets free health care program.
Mm-hmm.
Just be aware of that.
Be aware of that. If someone says, oh, well, this will fix everything. No.
Nothing ever fixes everything.
There's no silver bullets to healthcare.
Mm-mm.
There is no quick fixes to healthcare.
No, there's paths to fixing, but it's never quick.
Yes.
Yeah.
So, okay. Hey, try to have a great day.
Yep.
We are out of here for now.
Yes, indeed. Talk to you next week.
All right.
Bye.